Assalamu alaikum. Hello everyone. This is Dr. Fatima Qureshi with you guys. Today's video is about myopia and how to decrease the progression of myopia. I have been asked by a lot of mothers especially about this condition and how to help their kids decrease the progression in case their myopia is increasing really fast. Normally it's in the 6 to 13 years age group where we can help them. So myopia is nearsightedness, and that basically means that the kids can see up close but they cannot see far away, so they really need glasses, and therefore I highly recommend that the kids should need to come to their eye specialist or eye doctor, eye provider early on. So 6 years is a good age unless you see something drastic happening before then they can come sooner also. So with the corrective lenses, of course, we are helping the rays of light to focus on a particular point in the back of the eye, in the retina. But in myopia, which is nearsightedness, the rays are not going quite to the back of the eye or to the retinal area where the rays of light are supposed to focus and make a perfect image. And because of that, we help the patients with corrective lenses so that the rays of light can go and focus on that particular area. Now, if the myopia is progressing, then what do we do? Because when the nearsightedness is high, and sometimes we call it malignant myopia also, or really high myopia, then the retina is stretching because the axial length, the eyeball has a length, and the axial length is elongating. When it elongates, it can cause retinal complications such as retinal tears, detachments of the retina. It can also cause glaucoma, cataracts, and it can cause macular retinopathy also. So we need to decrease the progression so that the kids do not end up having those complications later on in their lives. So what do we do? First of all, we need to understand there is a global pandemic of myopia. During COVID times, so COVID started in end of 2019, beginning of 2020, at least here in the US, and I personally started seeing a lot more cases of myopia in kids. And I was like, why is this happening? So then I started reading about it. So according to research, when the kids are not exposed to sunlight, because the sun, and I think I mentioned that in another video of mine where I talked about vitamin D and how vitamin D can help in decreasing the progression of myopia. I discussed how the research has been done in Malaysia and in China because they tend to have the highest myopia all over the world. So when kids are exposed to sun rays or sunlight with vitamin D, that's known as a therapy actually. So during COVID times, the kids were indoors mostly, and they were working on their computers and iPhones, iPad. Pretty much all the classes were being conducted remotely. So that's why the myopia progression happened. And also because as a general rule, you need to not be on the computer or gadgets or electronic devices for an extensive period of time. So that's also increasing the number of myopia cases all over the world. So it has become a global pandemic actually. So I'm going to share with you what we can do, and when you bring the kids between 6 and 13 years of age, we can really help them. So first and foremost is the corrective lenses, but these are special lenses. These are known as executive bifocals. So they have the distance prescription on the top, and then they have the reading power on the bottom. So don't think that the kid is getting the simple bifocals that are needed when patients grow older, like in their 40s or 50s. I'm not talking about that. I'm talking about executive bifocals. So what happens is when the myopia is progressing, there is a condition, there's an area in the back of the eye which is known as myopic blur. So we need to address that area also because that tends to cause the axial length elongation. In simple terms, we need to help with the distance part as well as in the peripheral part of the retina where the myopic blur is supposedly happening. We need to fix that part as well so that their myopia does not or the axial length does not increase, and therefore they do not end up having complications later on in life. So that's number one, the easiest way. Number two, the kids can also do atropine drops. Now, this is something that a lot of patients have asked me. As a matter of fact, I have friends from my medical school who have kids, and they call me sometimes. And I have a friend who's in Canada, actually, shout out to her. I cannot mention her name, but she asked me for her son because she was concerned, and she's like, hey, I wanted your second opinion. Please let me know, what do you think about atropine and how it can be helpful. I actually have another friend of mine who was also concerned about it, and she lives in California, and she was like, please let me know. And someone in Houston I met recently at my parents' house, she was really very much concerned about how the atropine drops can help, or if there were other remedies that she could adopt for her kid. So atropine drops are technically used to make the pupils larger, okay, so they do dilate the pupils, but there's a dosage of atropine drops that can be used to decrease the progression of myopia therapeutically. So there's a 0.1%, which I do not recommend. Then there's a 0.01%, 0.025%, and 0.05%. According to the research that I have read, 0.05% tends to be the most effective because it has the least side effects. So patients will worry about, oh, when my kid uses the drops, is his vision going to get blurry? Well, 0.05% technically is the best, and it has shown to have the least side effects. So pretty much no, your kid would not be having the blurry vision. How does it affect the eyes? Well, it's going to dilate the pupil, it's going to help with the decrease in myopia progression, but it is used at nighttime. So it's the easiest way. FDA approved, you use 1 drop at night. So when the kid is going to bed, you put in 1 drop and the kid goes to bed, and then in the daytime, they will need glasses also. So just remember that. So easy, because again, 1 drop at night, the kids don't care about it. The parents have to be very much responsible for doing that for the kids, and then do the glasses in the daytime. This therapy has been shown to improve the progression of myopia and also make the prescription, I think I read in the research about 2 diopters improvement in the minus power. So that's good actually. So I do recommend atropine drops personally. And then of course you have to see your doctor, you have to see your eye specialist so that they can monitor and see how the drops are working for your kids. The second one that the third actually, because we discussed the executive bifocals, then we talked about atropine. Now the third one is a contact lens. It's an RGP, a hard gas permeable contact lens, and it's not very comfortable, I understand, but it has been used, and it is being used also as one of the remedies for decreasing the progression of myopia. So what this one does is that it is worn at nighttime. So basically it's an orthokeratology, so it's reshaping the surface of the cornea. The cornea, as I've told you and explained to you in several other videos, is steeper in the center, and then it is flatter in the sides, in the periphery. But in this situation, when we're putting in the hard contact lens on the cornea at nighttime in the kid's eyes, is going to flatten the central part of the cornea and kind of have a steepening on the peripheral side. So almost like a plateau effect, and the kids go to bed with that. They have to use it every night, and then in the daytime they don't have to wear glasses. So remember that. Sometimes it can cause corneal haze, corneal edema. Those have been reported also. Again, it's a good effective remedy, but a lot of patients or parents avoid using it just because of the fact it's a little uncomfortable for the kids. So that was number 3. So remember, orthokeratology, ortho-K, gas permeable contact lens can be used also. And then there is another one, which is my side contact lens. This is actually a soft contact lens, but it has distance correction in the center, and then in the mid periphery of the contact lens there will be plus power. So it's a specialty contact lens. And I know a lot of doctors probably are not doing this one because a lot of clinics are not equipped with this kind of contact lens. They do not have it in the office. But if you ask the doctors around in your area, maybe there's someone who has that in their office. So that is known as my side contact lens. It's a soft contact lens. So obviously it's a little bit more comfortable for the kids to wear. And this one is worn during the daytime. So the RGP is worn at nighttime for ortho-K, and the soft one is worn in the daytime. You obviously are not wearing glasses with that, so it's okay for kids who want to wear contact lenses. And then the 5th one is a special kind of lenses, like a spectacle lens that some companies are making. I know of Hoya. It makes that specialty lens for the glasses, and Hoya is the company that is the manufacturer for that. Again, maybe some doctors don't have that available in their offices, but basically what it is doing is similar to what the soft contact lens is doing. Again, there is the central part with the distance correction with the minus power, and then in the peripheral or mid periphery there will be the area focusing for the myopic blur, so it will have those plus powers in the mid periphery. So those glasses can be worn also during the daytime. But if you ask me personally which one I consider the most effective, of course atropine drops if the myopia is progressing really fast and there's a chance for having complications in the retina later on, and also chances for other eye complications that I discussed, such as glaucoma and macular retinopathy. So definitely talk to your eye care provider, talk to your eye specialists, eye doctors, so that you're well educated about these remedies. And I think it's very important to be knowledgeable and to have that information so that you can get prepared. Be prepared and go to your doctors and discuss these options with them. Definitely bring your kids to your doctors so that we can diagnose and detect things early on. And remember, outdoor activities is very, very important for decreasing the progression of myopia. So I covered pretty much all of the treatment options, and then in my next video I think I'm going to be talking about amblyopia, which is known as lazy eye in layman's terms, because a lot of patients have asked me about that condition as well, and I do get to see that a lot in the clinics. So we will talk about that one next time. I hope you guys have a wonderful day. Thank you. Bye.